The inside story on the issues that affect you and your community. This is Local 12 Newsmakers.
Good morning and welcome to Local 12's Newsmakers. I'm Dan Hurley. Any social scientist knows the dangers of averages. Nowhere is that more telling than popular discussions about life expectancy. It is reassuring to note that over the last 150 years, the life expectancy of a typical American has basically doubled. Although most of us know that an average like that masks many differences, like women live longer than men, whites live longer than African Americans. We tend to focus on the overall average. It's comforting. But a recent study completed by the Cincinnati Health Department that focuses on the differences between life expectancy in the 47 neighborhood clusters they identified in the city exposes significant differences between groups of people, but raises important questions about policy and how we move forward. To discuss this study, I am joined now by the principal investigator, Dr. Camille Jones, the Assistant Health Commissioner for Community Health and Environmental Services, and Dr. Alvin Jackson, who is a physician with the Cincinnati Health Department at the Northside Health Center. He was an expert panelist on the 2012 Institute of Medicine project, the U.S. Health in an international perspective. Welcome to Newsmakers. I have been, as I told you before we got started, I've been wanting to get to this ever since the report came out, and things like elections and streetcars have been in my way, so I'm really glad to have you here. Dr. Jones, what prompted this study?
Well, we actually had put out some information about mortality rates in neighborhoods several years ago, but found that while people were very interested in it, they actually didn't really quite internalize the full meaning of the differences in mortality rates. It's much easier for people to understand a 20-year difference in lifespan, and it's more intuitive. And so we felt that that would be a stimulus to people thinking more about health in the neighborhoods.
Dr. Jackson, you've been to Cincinnati for a couple of years now. So you've done this study that really has an international perspective. Are the tendencies that we see in this study, these differences between neighborhoods, are they surprising to you, or would we find similar patterns in other cities, at least in the United States?
Let me just make one clarification. First of all, I am on the board of the Institute of Medicine Board on Population Health. And whereas the IOM have put out several studies, the ones you made reference to, I work primarily on the study with primary care and public health. But I am certainly aware of the other IOM studies, and clearly the study really coincides and validate the information that the city health department put out. And we do need to take a closer look at communities and what is happening at the community level so that we can rightfully address those issues.
I want to bring the map back up, and we just sort of put it up real quickly. And I know that the viewers can't read this in detail, but even just looking at it in broad, it is clear from the color coding that there's something different about what's going on in the middle of the city, running up sort of right in the center, from most other places that are in lighter blue. What's that map? Just if you just saw that map, what's it trying to say?
It's trying to say that there are significant differences in life expectancy across neighborhoods, sometimes for neighborhoods that are adjacent to each other, and that there's opportunity for improving if we focus on those neighborhoods and try to see, what's going on, what are the low-lying fruit, what can we do?
So you've got these 47 different neighborhoods, and some of them are clustered.
Yes.
So we use 52 usually, so you got 47. And on the high end, I just have a bit of a graph here, or a full screen to show this. On the high end, in terms of life expectancy, look at a place like Mount Lookout, Columbia Tusculum, and it has an average lifespan of 87.8 years.
Yes.
And on the low end, a place like South Fairmount, 66.4 years. This is more, and you've made reference to this before, more than a 20-year difference between these two areas. I mean, that's almost, that's downright shocking.
Yes.
20 years inside one city. So, Dr. Johnson, what do you see as some of the factors that drive that difference?
There are many, many factors, and those are some of the factors that the Institute of Medicine actually took a look at in some of the studies that they've put out. Where you live determines how long you live. And there are factors such as poverty. Poverty is a huge driver, particularly poverty in childhood. Educational level is another important factor, and access to health care. That's why it is so important that the Cincinnati Health Department have several clinical sites in the neighborhoods where these huge disparities exist. And part of what we're working on through our patient-centered medical home, where the patient becomes the center of the discussion in healthcare, to see if we can, from a patient perspective, look at some of these disparities and issues. And there are also many systemic issues that are beyond the individual level that has a huge impact. Where are your grocery stores? Do you have
the whole food desert concept?
That whole food desert concept. Is there healthy food? Transportation? Are there bike paths? Is there safety in the community where individuals want to go outside and exercise?
And
so
jobs.
there are a number of factors, yes.
And jobs. Are there jobs available, you know, for people in the neighborhoods?
The department has also issued in the past studies about infant mortality. And Cincinnati's infant mortality is almost twice the national average. Cincinnati-Hamilton County's infant mortality is almost 13.3 per 1,000 versus 6.8, if I remember your statistics correctly. How much does that infant mortality in certain neighborhoods really pull down? Because from a historian's point of view, social historian's point of view, one of the biggest changes to change life expectancy over cultures is the minimization of infant mortality. But here we live in a city that has a very high infant mortality. How much does that affect these figures?
It affects it a lot. Life expectancy is basically a way of saying, if you had a group of infants born today, how long would they live on average if the mortality rates didn't change in a neighborhood? So if you have high mortality rates in a neighborhood, that's affecting how long you think that child might live. If you can decrease that, the ranking of the neighborhoods might change a little bit. You know, early childhood, you know, young adulthood, you know, we know that Cincinnati has a high homicide mortality rate. It's much higher than the nation. It's much higher than some other major cities.
But also lower than a lot of other cities too.
Well, it's high though. It's high.
It's high, but we're
in the top 10. I mean, it's among the top 10 causes of death in the city. In the U.S., it doesn't even make the top 15. And so, you know, it's high, and it's something that could be worked on. Well, the homicide rates are especially high in young Black men, you know, and so if you can affect that, then that could change the life expectancy.
Because life expectancy, just on a racial basis, when you look at these statistics, there's a 10-year gap between white men and Black men. So that's a gap, not by neighborhood, but by race that's revealed in these statistics as well. How much do you think, and you're out in one of these neighborhood health centers, how much will the Affordable Care Act and the decision by Governor Kasich to have Ohio expand Medicaid, how much can that have an influence on these kinds of numbers? What do you think?
I think that's an extremely important influence, because there are more than 50 million individuals in the United States who are uninsured, and there's a large number in Ohio, and also a very large number in the communities that we currently serve. So if we can get access, we can get insurance for individuals that will give greater access. It would also bring funds into the community health center to allow us to take care of many other patients, which then can improve staffing. And so it really is a huge, I would say that this is one of the largest important public policy developments since the Great Society with the establishment of Medicaid and Medicare. And so I'm quite excited and really looking forward, particularly for the people that we serve. This is huge. Many of the patients that I see do not have any form of coverage, which then has an impact on getting secondary and tertiary care, which may have an impact on the referral system. And so as I work with patients every day, I'm often asked the question, when is that Affordable Care Act is going through? I think I want to delay getting this test until we can get some type of coverage. So there is a lot of buzz in the community about the Affordable Care Act, and I really think it is really an important initiative for our patients.
From an administrator's point of view for the entire health department of the city of Cincinnati, will the Affordable Care Act in its implementation, let's say it takes a few years to really get completely up and going, how much will that affect the need for a city-based public health department? And particularly out having these sorts of clinics and services out in the neighborhoods. Does this undermine the need for that because people will now have access to other doctors, or is this just going to make it easier for people to get to those and feel better about getting care at these services?
I think that it's going to make it easier for people. We currently serve almost, or actually more than 10% of the city population, of whom 60% were uninsured. And so having those...
Wait a minute, back up. 60% of the people you serve are uninsured?
Are uninsured at this point.
Okay.
And so being able to have those funds come in to support the services that we're providing, you know, it's going to be very important. But there's also some things that the health department could do that we may be able to do with the increasing funds. You know, we have the infant vitality, effort that's going on. We're working with healthy homes and trying to increase the amount of healthy homes assessments that we're doing. You know, there's a lot of public health interventions that could be done if there was additional support, because right now we're spending a lot to support the uninsured, and they have nowhere else, to go.
And is that what you were just describing in some of those programs that you were mentioning? Is that just a parallel to what we see with those of us who have insurance through our employers, with the whole stress on wellness? You know, that private insurers and your doctors don't want you to wait until you're sick. They want wellness care because it can avoid the big, costly, high-ticket items. And is some of that a healthy home? I'm not sure about all the details. But is that some of the same stress you're making, a wellness approach?
Yes. You know, we found that when we go into homes and offer the Healthy Homes Assessment, that if people have complained about one particular health hazard, on average we're finding 2 that are citable. One that the person didn't complain about, one that they did. And if you can, address both of those at the same time, then you're improving the health of that household.
You were mentioning the school-based clinics. The one that I'm most familiar with is at Euler School, which is just incredibly impressive. And we had Craig Hockenberry, when he was the principal, on this show a number of times to talk about that and many other things. But when we say that people are uninsured, because in that situation, I know, to open the eye clinic or to open one of the clinics at Euler, the outside vendor had to guarantee that the school wouldn't incur any cost. They were going to pass that cost along to, I assumed, Medicaid in most situations. But when you say 60% of the people you see in your clinics don't have any insurance, who pays for that? Who pays for those 60%?
Well, you know, that's why it's very important recently that we have become a part of the community health center movement, because that allows the integration of local, state, and federal dollars, which will help us. But certainly with the expansion of Medicaid, that is why there is a very strong argument for the Affordable Care Act. And I appreciate the fact that you talked about this whole focus on wellness, because in America we've really operated as a sick care society for a very long time. And right now we are really in the midst of a huge transformation in terms of a strong emphasis on wellness. When we look at 1900, life expectancy was 47 years. By the 1999, we had gained 30 additional years, and many of these years have come through public health initiatives. And this is why I see a strong importance of having clinics in public health facilities, because this is one of the things that we talked about in the institutional medicine study, is how do we then integrate those two entities to improve on health disparities.
And can I add something to that also? The city of Cincinnati supports the care of the uninsured through the general fund dollars also. And this is why it's really important, you know, that we have that, because we have people that, you know, are not generally sought out after by other medical providers that we've been doing the safety net care for.
And I'm just about out of time, but I want to turn our attention. We've been talking about some national trends or state trends with the expansion of Medicaid and the Affordable Care Act. What is this study, what are you hoping it does for local policymakers, whether that's the elected city council or the people who lead the city government and the city health department? What do you hope this drives for them?
Hoping that there's going to be increased collaboration, increased activity and energy thinking about health, and think about health at the local level, because people at the local level have more of a clue what's going on, what could be low-lying fruit to intervene on.
Okay. Well, thank you very much. We're going to be paying attention to this. I got a feeling I'll come back to this. I want to make sure people know that they can get a voice and follow up to this study. If you'd like to weigh in, as a community, what we should do in response to this study, the health department will host a community roundtable on Friday, January the 10th, 2014. That may be the first time I've said that. Registration will begin at 8:30 with the program starting at 9. The roundtable will be held at the Community Action Agency in Bond Hill. And you can get information about that on the Cincinnati Health Department website. Thank you very much for being here this morning.
Thank you for having us.
It's been our pleasure.
Stay tuned. Stay tuned after the break. A quiet effort in northern Kentucky that reaches back 80+ years to bring a smile to local children at Christmas. Welcome back. We all want to believe that Santa makes a visit to every home on Christmas Eve, leaving a toy for every child. But every adult knows that myth doesn't work without a lot of help from a lot of community groups. In northern Kentucky, one effort, the Stein Toy Foundation, has been helping Santa for over 80 years. This effort started because of the generosity of one couple, and it has grown over the years because of the dedication of committed volunteers. I am joined now by Roy Bitter, a director of the Stein Toy Foundation. Roy, welcome to Newsmakers.
Thank you very much.
We just met the other day and the Northern Kentucky Chamber meeting, and I was so impressed that I thought this would be good.
Yeah.
Tell me how you were first touched by what becomes known as the Stein Toy Foundation, but how were you first touched?
In 1949, my father was out of work. I was the oldest of 5 children, and we weren't going to have a Christmas. And Christmas Eve day, a knock came at the door. There were some boxes that were thrown into the living room, and they were gone as quick as they came. We didn't know who had left the toys. We were not sure how they got our name, and quite frankly, it wasn't until 1955 that I really found out who did it, and that's when I started working with the Steinfurt Foundation.
And before we talk about them as a foundation, they're two real people, right?
George and Rose Steinfurt. They were two people who really had no children. They saw a need back during the Depression. There weren't any umbrellas back then like we have today. I mean, if your neighbor didn't help you or your church didn't help you, you got no help. And they saw a need, and they started filling that need. It was a Santa's workshop that they had there on 6th Street.
In Covington.
In Covington, yes. They would collect toys all year. They would repair them and deliver them at Christmas time. The generosity of some of the people in the neighborhood that they had helped or that knew of the project and wanted to help, they would contribute some money, but a lot of George and Rose's money went into this project and their efforts.
Well, George and Rose Steinfurt are both dead. They're gone. But this lives on. It's now a foundation run by volunteers, right? How many of you?
There are 9 of us. And a lot of elves, as we call it, that show up at Christmas time to help with the packing, delivery, and that type of stuff. The packing will actually take place tomorrow, Saturday.
Well, I want to be clear. We're taping on Friday, but this is going to air on Sunday. So, okay.
It will be done by then, and the delivery will take place the following Saturday. George died in 1980, and Rose preceded him 1973. And when Rose died, she asked that George not continue the project because his health was failing. He was going to abide by that, and some of the Covington County JCs, like myself, felt that a tradition was going away. So we talked George into continuing one more year. And then after that year, we finally convinced him that maybe we should have a foundation to continue this.
How many families are you able to serve in a year now?
Last year we served 850 families, 2,600 children. That was all done, by the way, on a budget of about $32,000. And I want to point out that we make Christmas for the family. We don't just give a toy away to a child. This year we're already at over 2,600, and we're expecting to top out around 2,700 to 2,800.
And when you say you make Christmas, what does that mean?
There will be one major toy, and there will be several minor toys, if you will. And there will be some educational fill-in items. We always put those in. And if there are 9 children in a family, we make Christmas for 9 children. If there are 2 children in a family, we make Christmas for 2 children. If you come down anytime to pack, you will see that we're pretty organized. We have a small space, so we have to make the best of that.
Well, luckily a lot of people are elf size.
Oh yes, thank God. But you know, it's boy 9, girl 9, boy 7, girl 6, and the elves go through then and pack the boxes up. They're carried back into the delivery room, which is very organized for delivery, and then
and where do the toys come from at this point?
We purchase most of the toys. We have 2 major projects. One is relatively new. Our golf outing has been going on for about 14 years now. Last year we formed one of the volunteers pulled together the toy event, which is an auction. That takes place, and actually took place the day before we're airing here.
That's right. I'm sorry I didn't get you before that. But so I want to make sure that people know how to contribute, And also on your website, there's a chance to alert you to families that need help.
Correct.
And so if you'd like to learn more about the foundation, support the foundation, recommend a family to receive presents, check out the website at steinfordtoyfoundation.org, or the mail post office box is 17634, Covington, Kentucky 41017. Roy, thank you for all the work you do.
You,
and
Dan.
thank you for being here this morning. Thank you for making Newsmakers a part of your Sunday morning. Join us again next week when I'll be joined by Jeffrey Blackwell, the new Cincinnati Chief of Police. Have a good week.